Quick question. Can you remember the entire coagulation cascade right now without opening your notes? Most MBBS students can't. For them, the three biggest exam traps are confusing the intrinsic and extrinsic pathway, forgetting the factor numbers, and mixing up the hemophilia type, and then lose marks in exam. But what if I told you that you can remember the entire chapter using just 5 simple memory slides? In the next 3 minutes, I will help you to lock hemostasis and coagulation into your memory forever. Let's start with the simplest memory formula of the entire chapter. Don't memorize the whole chapter. Just memorize 3 words: stop, plug, and clot. First comes the injury. The body immediately stops blood loss by vasoconstriction. That's the stop phase. Next comes the platelet plug formation. That's the plug phase. And finally, the coagulation produces fibrin and stable clot. That's the clot phase. So, whenever the examiner asks about hemostasis, think stop, plug, and clot. The whole chapter begins with this. By the end of this video, you will be able to redraw the entire coagulation cascade in 20 seconds. This is the slide that removes 90% of students' confusion, the difference between intrinsic and extrinsic pathway. Intrinsic. It triggers by blood injury inside the blood vessel. The speed is slow. It starts with factor 12. It is having a longer path. And remember, intrinsic is internal, whereas extrinsic start by the tissue injury outside the blood vessel. It is a faster. It starts with factor 3. It is having shorter path. And remember, extrinsic is external. And this is the main important point. Don't forget this. Both the pathways meet at only one place, that is factor 10. If you remember nothing else from this chapter, remember one thing. Intrinsic is internal, extrinsic is external, and both meet at common point factor 10. Now let's memorize the factor numbers. No mugging up, just follow the pathway. Intrinsic pathway. It starts with factor 12, 11, 9, 8. Then it reaches factor 10. Then extrinsic pathway, factor 3, 7. Then it reaches factor 10. And after this, both follow the same common pathway, that is 10, 5, 2, 1. Now important trap, that is the factor 6 does not exist, but many students write it in exam. Don't do that. So memorize only 12, 11, 9, 8, 3, 7, 10, 5, 2, 1. That's enough for exam result. Now let's convert the entire cascade into a road map. Imagine two roads. One road is intrinsic, the second road is extrinsic. Different roads, different starting point, but both roads reach the same junction, that is factor 10. And after factor 10, journey becomes easy. That is, the prothrombin becomes thrombin. This thrombin converts fibrinogen into fibrin, and fibrin forms the clot. Remember this line. Different roads, same junction, factor 10. Let's see few other differences between intrinsic pathway and extrinsic pathway. Intrinsic pathway. It is mainly triggered by vascular damage, whereas extrinsic pathway by tissue trauma. Intrinsic pathway, the factors are 12, 11, 9, 8, whereas extrinsic pathway only factor 7. The lab test monitored for intrinsic pathway are APTT, whereas for extrinsic pathway it is prothrombin time. Remember, PTT is a longer word, monitors the longest pathway, that is intrinsic pathway, whereas PT is a shorter word, monitor the shorter pathway, that is extrinsic pathway. Now let's finish the highest yield exam fact. First, vitamin K factors. Use this number 1972. That means factor 10, 9, 7, 2. Whenever someone asks vitamin K factors, just remember 1972. Next, hemophilia. A equals 8, B equals 9, C equals 11. A is equal to 8, 9 and 11. And finally, factor 13. Factor 13 stabilizes fibrin. Think of it as a cement that makes the clot strong. So without factor 13, the clot remains weak. Now look at this page carefully. This single page can help you revise the entire chapter before entering the exam hall. What is master flow? Stop, plug and clot. Intrinsic pathway is internal, long pathway. Extrinsic pathway is external, shorter pathway. Intrinsic start with 12, 11, 9, 8. Extrinsic start with 3, 7. Common pathway 10, 5, 2, 1. Vitamin K factors 1972. Hemophilia types A, B, C 8, 9, 11. And one viva favorite. What is serum? Serum is plasma minus clotting factors. If you can reproduce this page from memory, you can write the entire answer. Now test yourself. Pause this video, take a blank sheet, and try drawing everything you have just learned from the memory. If you can write stop, plug, clot, 12, 11, 9, 8, 3, 7, 10, 5, 2, 1, 1972, and hemophilia ABC 8, 9, 11, then you have already mastered the most important exam point. For complete university 10 marks answer presentation, watch the main video. And for rapid revision before exam, watch the 5-minute revision video next. All the best for your exams.